Hi, everybody. My name is Lucia Juarez. I'm part of the COVID-19 vaccine hesitancy interview team. And today I have the pleasure of interviewing Dr. Khendra Peay and Dr. Quintin Chipley. Welcome.
Thank you.
Pleasure to be here.
Great. So I'll first begin by introducing Dr. Peay. Dr. Khendra Peay is a child and adolescent psychiatrist in Washington, D.C. She obtained her BA in psychology from Wellesley College, where she also completed her pre-medical educational track, and an MD from Virginia Commonwealth University School of Medicine. Dr. Peay is an assembly representative for the Greater Washington region of the American Academy of Child and Adolescent Psychiatry. She has also practiced in outpatient and inpatient clinical settings and consults for clinical training and community education programs. She directs mental health programming at Hood Medicine and works on the steering committee to improve access to mental health care. Thank you. Dr. Quintin Chipley is a retired psychologist who formerly served as the counseling coordinator for the University of Louisville Health Sciences Center. He earned a BA at Rice University and also holds a Master's of Divinity from Southeastern Theological Seminary. He earned his Master's in Clinical Psychology, his medical degree, and his PhD from the University of Louisville. His passion is focused on abstinence-based peer support recovery, communities, and transitional living for those in recovery from addiction. He currently serves on the board for Beacon House, a local sober transitional living facility in Louisville, Kentucky. He steers mental health policy and programming initiatives for Hood Medicine.
Thank you.
Thank you both for being here. So I'll begin. I'll jump into the questions. Either of you feel free to answer the questions. Thank you. Can you give a brief overview of what Hood Medicine is and what the goals of your program, and describe how your work with the disability and neurodivergent community?
Well, I will defer first, if you don't mind, to Dr. Peay, mainly because she has a longer track record of history with some of the people who began Hood. It's a shame that we don't have Dr. Shanice Hudson on, because she has a patter spiel on this, which is really quite succinct and very funny in some respects. But as she says, it's an assembly of scientists, geeks, and physicians and hackers who are committed to bringing, I think, greater equity in healthcare to the underserved populations, particularly within the Black and Indigenous populations of the Pacific Islanders. That was their specific motivation, and it was, I guess you'd say, sparked, of course, by the COVID-19 crisis, because those communities were disproportionately affected both with morbidity and mortality, and also they were disproportionately affected by the mental health issues, which were secondary both to the direct impact of the disease and the disruption of social structures along the way, such as schooling in person and work relationships, income, etc. So, there was a strong nexus, evidently, of the organizers who all knew each other from times at MIT or in the Boston-Cambridge area, of course. So that's about what I know about it. Dr. Peay, I'll turn it over to you.
And so I am new to work with the Hood Medicine group, but like Dr. Chipley said, I've known the organizers for years, but I was attracted to their work because of what they've been doing to increase education, awareness of comorbidities and different health issues that are affecting communities that are underserved and communities that typically don't have the same access to care that we might see just otherwise, just from a societal standpoint. So my role outside of hood medicine is completely working with child and adolescent populations and also psychiatric, neuropsychiatric, and neurodevelopmental disabilities. So their work in particular in targeting education and really getting awareness for there being more services, more awareness for the health needs being met for populations that otherwise don't necessarily get acknowledged as being needing to be met was something that really drew me to enjoying working with them.
Your team is made up of a variety of experts, including hackers. How would you say that holistic approach contributes to your mission in hood medicine?
I could say for myself because I'm definitely not a hacker. I appreciate I appreciate the global picture of the group. So I feel like it really mirrors what society looks like. And when we're talking about treatment and talking about community resources in general, it really takes into account that it takes a community of different strengths, different backgrounds, different things that we can all bring to the table for the same goal of really trying to improve our communities in general. And when I say communities, like all of our communities.
Yeah, I would say what I have observed, and I too am definitely, I'm way too old to be called a hacker. You know? I do well to get my password correct to get into a program. But what I've observed is that the members and their friends that they've recruited bring a fluency with social media techniques uh, and with graphics, with the power of naming, uh, of creating memes that are going to be effective. The they have they have their finger on the pulse of a rising generation, which I only wish that I knew as well as they do, and so that's been very important. But they really do understand the digital arena that just saturates the population at this point, and I think that is one of the greatest strengths as far as the holistic approach to this, because they see how those particular digital tendrils actually move into each one of the disciplines.
Mhm. How would you say all these expertise work together to accomplish this goal?
From my end, I feel like it really is because we're all coming from such different backgrounds. We're able to work in a congruent way, which is amazing. But we all come from really different backgrounds. I mean, my background is purely medical, so I don't have a lot of awareness when it comes to technology and when it comes to marketing or when it comes to just a lot of the other areas that, or even when it comes, I mean, there are aspects of public health that have to do with just direct medicine I'm aware of, but then we have people who are purely, that is all they do is public health. So it's exciting to work with people who we all have different training, different backgrounds, which allow us to come in with different strengths, but to be able to work together and really just with the same focus in mind of wanting to see better health for our communities, better health for the country, just better health in general and overall, not just mental health.
Yeah, I think that that is true. Uh, it's the fact that there is strong representation from the varied identified communities, the Black communities, the Indigenous communities, the governor is important. I personally am honored that I was asked to be part because I don't fit in those categories at all. And but it is I do think, quite frankly, that I one strength that I bring, and I hope that this comes across well. Um, uh, I am because I am from where time I was born, which was 1956, and where I was born, which is Memphis, Tennessee. I am inevitably a white privileged racist. Now, I am also by choice and by exposure a person who's chosen to become anti racist, but that does not eradicate the origin. It just means that I am able to recognize it and to help where I can within my community to say, look, we have our work to do, and this is not the BIPOC community's job. It's not their job to fix us. it is our job to fix ourselves in this regard. And I can learn from the community within Hood where my blind spots are along the way. And then we can also discover where there is a commonality where none of the origins actually matter. And that's quite frankly when you finally get down to the methods and statistical analysis and the conclusions of the scientific study. It's kind of like when you get down to the point where the numbers speak, then we can say, okay, this is this is the common language. It's almost like finding music in the common language. You find the common language in science and math. But the variety is very important. So I won't belabor the point, but I think that is important. I do think it is very critical to have both the public health perspective and the medical practitioner perspective, because as much as we try to see each other's world, we always have a slightly different focus. My focus is going to be on the person in the room with me, and the public health person is on the huge, large world beyond their walls constantly. And so we can each bring to each other that particular perspective, which helps remind us that not one perspective is going to encompass everything, that there is a parallax view that must be invoked in order to understand the greater truths that are happening.
Definitely have questions. What has your team learned from you and your patients' experiences from the COVID-19 pandemic in general, but also particularly with respect to the neurodivergent community?
So I'd say the biggest piece has been really an appreciation and not just acceptance of the fact that this is truly has been a global pandemic, and that every person has been affected. And so when we talk about anything that is either challenging or things that affect what my relationship or what my interaction with the world is, that would have been impacted just, of course, by the pandemic. But it being something across socioeconomic status, across gender, across race, just in all areas. So that was the biggest piece of them first acknowledging that everybody's affected no matter what, but then going into whatever disparities were happening before, whether it be a disparity in access to care, access to knowledge about care, those things were amplified too in terms of there being just a bigger gap in terms of access to that information and access to that care, which led to, as we saw, a lot of disparities in terms of who was primarily impacted by the global pandemic also. But that's be the biggest. And that then goes in when we're talking about neurodivergent communities also. Impacted just the same as everyone else was impacted, but when we're talking about having any type of health condition, then it's going to be an even greater impact when you have something that now is another insult basically from an immunological standpoint, but also just in terms of how it affected everything else. Our access to socialization, our access to supports, our access to coping skills that previously people would have been able to easily move into. So an even bigger impact in that sense.
Yeah. Well, first of all, when it comes to specific patients, by simple quirk of the calendar, I literally retired in January, about a month and a half before the pandemic was properly acknowledged and before restrictions set in. So the reality is that I was already out of the clinical setting, so I didn't have any patients myself. I will say what I've observed is an interesting fact that, and the second thing is I really have no specific experience with neurodivergence. I have thought a lot about the issue of of what is the impact of talking about vaccine after the wake of Wakefield and all of the trope of, of equating vaccination, quote, causing autism. And it's there's so many different ways in which that was wrong. First of all, it was fraudulent and fabricated, as it's been now proven. Uh, Secondly, it we had to really ask ourselves the question of what do we mean by quote causing um, autism? Uh, what is it people think that autism deserves quote a cause for? I will say my own experience as a human. It I am a member of a community that has had struggles. I'm a self-identified gay man, although uh, masculine by identification, he, him, etc. But I'm also familiar with the whole notions of the smothering mother notions of causing gayness, which of course was completely ridiculous, And first of all, it's not a cause. It's kind of like talking about any kind of characteristic of what caused me to be 6'1". I don't know. It's like um, and so getting back to the main point of neurodivergence, and I suppose, quite frankly, one could consider sexual orientation to be a version of neurodivergence. I mean, things are centered in the brain. There's no doubt about that. So uh, it strikes me that much of the neurodivergent community is burdened at this point with this whole notion, whether they're aware of it consciously or not, they're going to be burdened with this notion of vaccine and identity. But whether it was right or earned or proper is a whole different matter. And it's kind of interesting when you start thinking about not exactly parallel, but with the Black community having to struggle with the whole issue of medical apartheid in the history of the United States practice of medicine, whether it's obstetrics and gynecology, and the horrendous experimentations without anesthesia on non-consenting Black women, or when you talk about the problems with Tuskegee, and even then later on the transference of that to the brown people down in Central America, uh, it's like um, so you have situations in which people have been hurt by medical malpractice, and now they're faced with a situation where they're having to gain trust in a a, a statement of medical rescue, medical help, and that's quite a conundrum. It's been interesting to watch the fact that, quite frankly, uh, within the Black community in particular, they have proven themselves to be malleable and changeable. But when you address the realities of what we know about these particular vaccines now for COVID, which are proven to be safe and effective, and countering the issues about what really had happened to them in their community, a reality thing, not a conspiracy theory thing. You can move a person from an experience of true reality into true reality much more easily than you can move people from conspiracy theories into true reality. And that's what's been interesting to watch with the resistant, hyper conservative white community. They are not moving very rapidly because we're not arguing against saying this is, this, yes, you're right. This was a fact in the past, and now this is the fact in the present. It was a bad fact in the past, it's a good fact in the present, you're having to take on the whole argument of what you're thinking is not founded in truth, and it sets up a conundrum. Well, I did have the experience. One of the things that we were always taught was you don't confront a patient's delusions directly. You just don't, and so it's very difficult to confront the delusions. And so we've had more success in actually confronting. And the neurodivergent community may find it to be similar, that you can acknowledge to say this was an abuse of your identity in the past, and it is acknowledged as an abuse. And now we can move into a real reality now, which will be a benefit for your identity in the present. But that's just a thought. That's a hypothesis, and it's totally untested. It would be great if your project can take that forward and actually operationalize that in some sort of testable hypothesis.
One piece I just want to add from the COVID standpoint too is having to also take a step back and think about how scary it was for everybody. Like this was new to every single person. And as the medical community and public health, we're trying to even figure out what this is, what's going on, how do we treat this, who's being impacted. This is all still impacting people simultaneously. So for anyone, this would have been anxiety producing. For every single person, this was anxiety producing. So even if there wasn't a prior diagnosis of anxiety or a prior diagnosis of, let's say, depression, this was something that elicited responses that were really natural responses, but were, again, we didn't have access because of the nature of this disease. We didn't have access to things that would, for any community, be able to at least decrease necessarily the severity of symptoms. So this was all something I'd say going on simultaneously too, separate from the fact of how it was impacting some communities more. Then that just means we're talking an amplified effect for communities who already had pre-existing concerns, pre-existing illnesses. And also when we talk about, again, with BIPOC community, there being already an established disparity in access to healthcare and access to information about that healthcare, while the entire country and world is undergoing this novel situation that's anxiety producing for every single person.
Absolutely. I think what you mentioned about folks who already had experienced disparities, and now you have this COVID vaccine coming out, a lot of programs and organizations having to pivot to go online full mode without maybe not necessarily having the tools or the know-how to do it. But yet here we are, right, in June 2021, in a completely different remote world where we're able to have this conversation on Zoom, on different time settings. So there are some really good things coming out of it in some ways, but also I hear what you're saying about treating people with dignity and validating their experiences, right? That like, yes, it's true. This is what actually happened, and not making it seem like it didn't happen or that those things are in the past. Like, no, they're very real. And I think that starting from that perspective really helps establish that trust and that connection that you're going to need to move from the potential hesitancy that they may be experiencing to further, like, so what does that look like, and how as a medical professional can I support you work through those questions that you have.
This is exactly because it's a valid fear, it's a valid worry. And on my end, in my specialty, my goal is to make sure that things like anxiety, depression, ADHD don't basically become the decision maker. Like that is not the thing that impacts a decision for different things. I always want to encourage families to have an active communication, ask all questions of their primary care providers. But on my end, I want to make sure that at least the anxiety is not the thing that's making the decision for them, as opposed to it truly being an informed decision. Because there's a lot of reason for anxiety to basically come to the forefront and be something that could make decisions.
Yeah, I have told patients before, clients before, that particularly ones with depression, one of the things that we know about depression is that one of the first symptoms is it takes away your ability to take pleasure in or to have motivation in the things that you normally would. So as I tell them, I said, your favorite thing in the world could jump up off the floor and slap you in the face, and you wouldn't know it. You wouldn't know what's happening to you. So remember, get some people to help you with your thinking in this regard. Don't consider yourself invalid, but don't hesitate to reach out to help others to do reality testing with other people along the way, because your disease can actually cripple you. One of the things that's a little bit of a paradoxical treatment is to basically say, look, the medical system failed your people in the past royally. Don't let that happen to you twice. This time, grab hold of what's being offered to you that's actually real and helpful. Don't let the past bite you twice. It bit you once. Don't let the past bite you again. Don't let the past block you from what should be rightfully yours, which is the openness to a safe and healthy future. And that can sometimes muster up a little bit of, you're right. It's I can't let them. They knocked us down, but we can't let them keep us down. We have to move forward.
I think that's what's really about the work that Hood Medicine does, is that they acknowledge that, they bring it to the forefront, and they provide folks with the tools to advocate for themselves wherever they are at. So what are some reasons that you think have facilitated individuals or families who choose to receive the COVID-19 vaccine? I know you mentioned that depression could act as a potential barrier, or that other folks could have developed different mental health conditions that could potentially fog, the reasons why they may or may not get the COVID-19 vaccine. What are some reasons that you have seen that folks do get the COVID-19 vaccine?
Well, I would say those are actually also some of the same reasons that people have been getting the vaccine. It is really an awareness of, anytime we're talking about having any comorbid diagnoses, that puts you at a higher risk of how significant and how severe the impact is from COVID-19. So that's been a large decision maker for a lot of people, is that piece. And then the other piece also of wanting to get to a life of some degree of normalcy, and doing anything to move in that direction. But initially, I'd say a lot of it was also just knowing there were other medical issues and other things, and that playing a part also in terms of how people were impacted from just how COVID-19 led to further health issues, even for the families who were able to survive it.
Yeah, and now I don't have any direct experience in doing this. I will borrow from a pediatrician from Indianapolis who was speaking with us a couple of weeks ago, and he will tell, and he's had success with this. He said with his families who were resistant because they were afraid of the side effects of the vaccine, and he would say, "Well, do Pampers?" Now of course Pampers is the brand name, the trade name for the disposable diapers. He'd say, "Do Pampers cause brain cancer in toddlers?" And the parents would say, "Well, that's ridiculous." And then he'd say, "Well," he says, all these kids who are 3 years old who are diagnosed with brain cancer uh, were in Pampers when they were infants." And they will say, "Well, that just," and then they can start thinking for themselves the way that we think about covariance and statistics, about the fact that everybody wore Pampers, and that just because there was temporality involved, there wasn't causality involved. And the people can start seeing that, but he only goes at that after acknowledging the fact that he understands that they have strong concerns about the long-term safety and the health of the children. He understands that, and to affirm that in the parent is particularly important. To say, I'm not going to diss your concern for your kids. But now let's think about how we can actually visualize this and think about that in the best terms possible. And the pediatrician, of course, now he can gain their trust quite well because it was quite often he is himself a black man, and his population, patient population is primarily black, and so he has a rapport that's afforded to him that probably wouldn't come off as well if I were to try the same thing. And so having the right person say the right thing at the right time is going to be very important. And I can't assume that just because I'm right about something that I'm the right one to say it.
Yeah, absolutely. Representation matters, and delivery of the message matters.
Mm-hmm.
Absolutely. And something you mentioned earlier was how folks have a lot of hesitancy around vaccinations, making either assumptions or correlations or causation arguments between autism and vaccines. And that's one example of a barrier, right? What are some other additional reasons that folks or families may not receive the COVID-19 vaccine that you all have seen or have observed with colleagues or with your own patients?
Primarily fear. It's unknown. It's new and it's unknown, which I understand. One thing I want to add to in terms of things that reasons as to why people have been getting the vaccine also is for family and for community. People wanting to make sure that they didn't increase the risk of elder members in their family being infected, elder members of their community being infected, or individuals with increased health vulnerabilities being infected. So that actually being another reason as to why people have really been open to getting the vaccine, really thinking about other people that they did not want to be impacted. But the primary reason, fear. Now, in terms of like medical providers, we've been quicker to get it in terms of physicians because that is the place we're coming from, is that we want to make sure that we don't put ourselves in a position that we would get anyone else sick or get anyone else infected. And that's where you had so many health providers who weren't seeing their families for extended periods of time during really the thick of the pandemic, or, just not being able to be around other people outside of who was ever in the bubble, similar to what we're talking, just for everybody, but just also from in terms of immediate people because of not wanting to infect. But fear has really been the biggest. It was an unknown, and it took a while for there to be enough information disseminated for people to really understand what not only the virus truly was, but also what we were talking in terms of the vaccine, and that this wasn't something that had just now been developed, really it being something that had been in the works for decades prior to it, and it being something that then this was now we had a time to basically quickly get use of it, but it was not a novel development. But that took a long time for people. And then there are still people who don't necessarily know that, which again goes to, just access to information and dissemination of information and making sure when people are making informed decisions that they're truly making fully informed decisions.
I would say that, well, first of all, I'm in Louisville, Kentucky. And surprisingly enough, Kentucky had a very progressive and advanced response with provision of vaccine opportunities compared to what you would find in some of our neighboring states, particularly when you compare it to Tennessee. This was early. It was organized better. It was a top-down organization that enlisted local bodies well. So that was very good. So what that meant was that opportunity for vaccination actually was spread pretty quickly within our communities, particularly around Louisville, quite well, very quickly. But that's not uniform across all of Louisville. There are certain sections of Louisville that are particularly underrepresented. Of course, this is not a matter of providers' offices. This is because these vaccines were not being distributed in providers' offices. They were being distributed either in municipal centers or in pharmacy locations. But there are neighborhoods here that are pharmacy deserts, where and those are also the same neighborhoods where people don't have independent vehicles, individual vehicles, where they are, they're quite dependent upon bus lines, and the bus lines are mediocre at best. You also have people who they did not have the flexibility for the most part of working from home if they were working. And so they were having to negotiate other kinds of realities. And by the time you take all of these different variables in the regression equation, and also match the variable with the appropriate coefficient along the way, you're going to strike the y-axis at a slightly different place than you are for our privileged East End community. And so some didn't have the ease of being able to get onto the internet and to book their appointment very quickly when they were first available. And they didn't have the ease of being able to take off from work and to have their own car, because these were mostly drive-through vaccinations. So you had to be able to drive through. So you had to have someone take you if you didn't own a car, or you had to borrow somebody's car if you could, or things like this. It wasn't like you could walk up. It's almost like people try to do walk-ups to ATMs at banks, and they actually get punished for it along the way. They're not supposed to do that. You're supposed to be in a car, kind of thing. And so, so there were other socioeconomic variables that were at play. I will say that, quite frankly, we are at a point right now to where if someone decides that they want a vaccine, they can pretty much get it without a huge number of barriers in front of them here in the middle of June. That things have loosened up over the last 6 to 8 weeks considerably in that regard. But this is not true for all of our regions. It's not true for all of our states.
Yeah, you hit on such a great point that there's a lot of prior pre-existing conditions that are structural, like folks not being able to take time off from work, not having transportation, not having like internet, or something fascinating that you mentioned was pharmacy deserts, right? That they don't even have access to proper medical, not necessarily medical care, but the medicine themselves to cure them. So now you're talking about another added layer of health with this COVID-19 vaccine that we're all shifting and pivoting to try to figure out how we can support all populations, but also the most vulnerable folks. So in what ways would you say that as physicians you have, or as just individuals in the medical field, you have supported families in assisting to receive the vaccine? So you mentioned that now it's a little bit more easier. How, for example, for folks who have limited access to make an appointment, in what ways have those barriers been mitigated or ameliorated to support access to that vaccine?
For me, just making sure that that they have access to information as to where they can obtain it and where might be a place local. At the end of the day, I still leave it to the family. It's their individual decision on getting it. So I still encourage just them having information so that they're making an informed decision on, if this would be a benefit and why this would be a benefit, but increasing that trust in their primary care. But once we're at that place, just making sure that that they're aware of the places that can, and it's like Dr. Chipley said, there's access. I have the benefit of being in an area that it has a lot of access now. There was not that access last year so much, but in terms of there being mobile vaccine clinics, not just the pharmacies, but literally you kind of go down most streets and get it. The health departments have set up a lot of different locations. So there is more access now, especially now that they've opened it up to children, well, to teenagers. There's even more access available than there even was when it was just adults. So just making sure that at least they're aware of those places and options, but families are finding it.
Yes, and around in Louisville, I know that there was that the health department, in conjunction with some of the large hospital corporations, really worked together well. They did some pop-up drive-throughs, pop-up walk-in trailer vaccination in some of the more poorly accessed communities, the Black communities, the brown communities. I believe now. Don't I'm going to go out on a limb and say this. I think they even set up one at the Churchill Downs, there at the backside of the track, because that's a heavy Latinx population. The track workers are uh, uh, they're able to meet the community where they were found, and using the traditional Black churches was one of the strong avenues from here. Although even the Black church leaders would say, "Well, yes, we can get the old people, but the young people don't come to church. We don't know how to get them, And so, but they were, we 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 did see that to be an effective way to help. It's still not quite the same thing as having the Kroger pharmacy or having the CVS and the Walgreens, which right now all have the signs up saying walk-in, COVID vaccinations are available. The problem is you've got to be able to get to that location to walk in, and they're all more than 2 miles away from most people's homes. Uh, so uh, there is still the whole. It it's I mean, the math modeling of that is the modeling that goes along with fluid dynamics, that you're always going to find greater flow along the easiest paths. And, and so therefore uh, privilege begets privilege, unfortunately, without any consciousness to it. It's just simply privilege begets privilege.
One thing that's nice that, and this speaks to what Dr. Chipley was saying, there's been a nice shift to access the areas that are known to everybody. So before it was at a point where it was like you had to figure out where this place was or where this station, versus there's really been a shift to it now being available where you can get the vaccine at a mass area that everyone knows to, the public transportation is able to get to, but at locations that everybody knows, so that increases the chance and the likelihood of more people having access to getting vaccinated.
I definitely hear what you're saying. It's visibility, establishment, and a partnership with well-known organizations that already have the trust of the community and leveraging that to support the COVID-19 rollout. Absolutely. You also mentioned information, and I'm wondering what methods do you use to provide correct information or facts regarding the COVID-19 vaccine?
I do like to still refer to the tried and true CDC because they are technically dictating our steps. So I do reference there, but I also reference other organizations like NIH and just places that I know, are doing either research in different areas. But the first place I always recommend families to go to is, and I know I said it, but it's true. I recommend them go to their primary care because at the end of the day, that's their central person who's managing just from a central aspect their care. Especially if we come in and we support and we do everything we can do to make sure that health is in a good place, but there's still that central person for them too. So that's always my primary that I refer them to go back to. With the CDC, yeah, because right now that's where we're all getting our information and who, yeah, but my CDC.
Yeah, and now Hood Medicine Initiative in particular, of course, its website is a very important source for both posting sources outside, but also posting its own infographics. And they've done, I think, quite frankly, a very good job of. They are very simplified, but they are accurate infographics about both the pathophysiology of the disease, the thing, and also trying to dispel myths about the vaccination. Um, Even to do a little preaching here and there about, watch out where you go for the clubs and stuff of this nature. So that's been important. Now, and they also will repost interviews which that they participate in from the Sirius news broadcast that's posted out of Los Angeles. The name now is I'm blanking on, but it's a tremendous Sirius radio broadcast. They've been on, I think, 3 times now. And Hood has been able to have a strong YouTube presence with the interviews with, of course, with even with Dr. Peter Hotez and others. That's been very important. Um, um, you know, and bringing up to the minute as which is possible, accurate information. And when things are ambiguous, uh, allowing that to be a statement, saying, this is not exactly certain right now, and not trying to gloss over that, and also to not gloss over the fact that science sometimes has to change on a dime when data comes across as different. Now, move to a different thing here locally. Um, in the the, traditional Black neighborhood areas of Louisville, they are billboarding pro-vaccination signs, and this is not Hood Medicine doing this, and I'm not exactly sure which organization is funding this. I think it's coming out of the health department, a grant that they've got to deal with this. But it is specifically targeting those neighborhoods, really encouraging vaccination and saying things such as herd immunity needs you, and sort of, herd immunity for the hood, you are important, and showing and almost tantalizing people with pictures of basketball arenas. But we have a very important big basketball arena here, which is quite often used now for the Final Four, and they'll show it full, and it's basically kind of like saying, you need to be vaccinated, with the idea that if we all get vaccinated, we can get back to here. And you can bait a lot of people with basketball in Kentucky. Let me tell you, that is that's like religion here. So I've been quite impressed with the fact that they really have, been targeting the underserved communities in this regard.
Yeah, absolutely. I think what you mentioned about following CDC guidelines is really important, because as we've seen throughout the year, things have been changing sometimes from day to day, week to week, month to month, and it's just a lot of change. And often for people, just change can be really hard to move with. However, knowing that there is a trusted website like the CDC, or I think you mentioned the NIH, that those are trusted sources that folks could go to. But I think that Hood Medicine does such a great job, like you mentioned, of creating infographics that are attractive, that are digestible, because sometimes these websites can have very lengthy language that maybe just regular people who just want to see it quick and fast won't be able to access or understand. And so the job, or the work of Hood Medicine is really impactful in that way. I wanted to ask you, in what ways would you say you counsel or support patients of color, or folks who from the disabled communities who are hesitant about receiving the COVID-19 vaccine? What has worked best and what hasn't worked as well?
I start from where they're coming from. So first I want to know, what is the core, what's the core behind your decision and your fear and your thoughts? Because even when we're talking about, with BIPOC community, it's still going to be an individual decision at the end of the day also. So it's really starting with, okay, what is it for you as an individual that makes you hesitant? What is it for you that makes you feel like this is not something that you can trust? And then we work from there to see what parts of that are based in science, what parts are based in information, what parts are based in actual reality, what parts are based in my anxiety is just purely. And I'm not basing it on any information, on anything that I've read or heard. It's just purely based on fear. So then once we determine what's really behind that thought and that hesitancy, then that's when we're able to get to, okay, let's take the layers down so that we can truly make sure it's a well-informed decision. Because if it is something, let's say, not based on truly being informed, then we work on getting informed so that it can truly be a decision that's okay. Now, if I am deciding this, then at least I've taken into account all these other things. Or if I'm getting information, am I getting information from appropriate sources? Or am I getting information from opinion pieces? Because that is not necessarily going to be fact based. So that's the other piece too, and making sure is the information we're getting fact based information, because I definitely work from a world of facts. But then also if it is anxiety and that being the primary, or depression or something like that, then we work to reduce those symptoms, because then that wouldn't just be impacting that decision, it's impacting all decision making.
Right. Yes. That's correct. Yeah. And I would say too that well, I don't. Once again, I'm not going to say that I have direct experience or any measured experience of what worked and what didn't. I have heard some anecdotes from the people. Um, for instance, Hood Medicine did have an interview in which we had a woman who is PhD, MD, I believe, Black epidemiologist. And one of the nice things was that she talked about her initial hesitancy when they were starting to roll out the vaccines in the fall. And and quite frankly, I'm one who was noted for this too. I kept saying last year in August, I said, I will believe it when I see it, because I said, I know a little bit about coronaviruses and they don't behave well. And of course, my training in virology is ancient. It was in the middle 90s, and there was no knowledge of mRNA technology at that time. Everything was going to be a protein attachment based, and so I just was like very, very skeptical at first about all of this. And but getting back to the main point, this particular scientist was able to say that she was skeptical, and so what did she do? She went and downloaded all the articles. Now, she wasn't saying to the patient that they need to go read all those articles. She was basically saying, I know how to read all those articles. And I read them all, and she says, I was amazed. She says, this was good stuff, you know. And then they went in, and she was able to talk about, yes, this came about quickly, but that's because they put the money in it to allow it to be quick. They didn't have to wait for this lag time between phase 1, phase 2, and phase 3. They had enough money that you could just have them be seamless, moving one to another. You could start planning the logistics for phase 3 even while you were doing phase 1, which is not something that's normally available for any kind of vaccine development. So she was able to lay it out there saying, I was convinced. I have this training. I am a Black person. I understand our history. And I was able to go into this, and I was able to become convinced. And I think that is the thing that is going to be most persuasive, is to be able to say, you know, and to not tell people that they are silly or foolish for being reticent. To say, I understand exactly where your reticence is coming from.
And that's a piece to what you're describing also with her experience. That really speaks to how you're going to have different individuals that are going to respond to different things. So for some individuals, it really is going to have to be that they have to get all of the facts and all of that information to really feel like, okay, this is coming from an informed place. And you have other people who it needs to be that they see more people they know getting the vaccine.
Yes.
And seeing that they were fine and that they did okay. And that being something that gives them enough reassurance. And then for other people, seeing people that they respect, even if it's not someone they know personally, people they respect, or hearing someone that they trust what their words are, to be someone who's saying, look, I was okay, or this was okay. But it really having to be for that person, really determining what is it for them that would be something to reduce their particular hesitancy.
Yeah.
sharing our own personal stories, whether it be from a famous basketball player to your neighbor or some important family member, teacher, community figure who can really support lessen the vaccine hesitancy. I also heard you say agency, support, like validating again, a lot of validation and a lot of supporting the person's own decision that they can or cannot and when they're ready, as opposed to imposing something on a person. And I also heard you say that people should be making their most informed decision, and that through making the most informed decision, they can better just decide for themselves. And I think with a lot of, I know Hood Medicine puts out information on YouTube, but I also know that YouTube is a platform for so many people and organizations to put out whatever information they want. And that's the other really scary, I think, sometimes flip side to that, that we do live in a world where there's a lot of access to resources, and those resources may not always be vetted. So I'm wondering, in what way do you all help your patients feel more confident or empowered in getting vaccinated, given that there's so many different just ways of receiving that information, or just with a lot of like changes that are happening? How do you ensure that your patients who are getting the vaccine feel that it's safe and effective for them?
So for me, I just encourage transparency, and I encourage them to know that every time we talk, it's an honest place and an honest space to be able to talk about any concerns, questions, any doubts, any fears, any of those things. And even if it's not something that I would address from my specialty standpoint, then it's at least something where I can make sure what professional do they need to speak to provide more reassurance in that area. But it being something of really just making sure that they have a space where they can be heard in terms of any of those fears and thoughts and worries and hesitancies. Because I think to just pretend that there are no hesitancies or worries or not validated, that's when it just builds up and builds up and turns into its own thing, as opposed to acknowledging it, respecting it, but then working on it.
Yeah. And I would also, I mean, this sounds a little trivial, but I think it's very important to acknowledge the normal side effects of the vaccinations, particularly on the second dose, that there is a 2-dose regimen. And to let people, we don't have to overplay that, but to say, oh, yes, you're probably going to feel kind of lousy for a day or two, and that's all right. That means it's working. Now, not everyone does, and that doesn't mean it's not working for them. But say, that's just what we expect, along the way. And to contextualize it in that regard, most people don't realize that they're, when they get the childhood vaccination, the kid probably felt lousy. It's just that all they knew how to do was, cry about it quite a bit, But so just being truthful about that and saying that that's okay. That's just one of the things that happens along the way, and you'll get over it and you'll be better for it. I mean, my personal experience was that the Shingrix vaccination, particularly the second shot, was a whole lot more debilitating than the second shot of the Moderna was for me. But I knew that in advance. I kind of scheduled a weekend off, and that was going to be it.
Yeah, I definitely hear what you're saying about normalizing not only the fear around getting the COVID-19 vaccine, but also the side effects of getting the COVID-19 vaccine. And with that, supporting the person, the individual is able to create a plan for themselves, like maybe have their own snacks or their own self-care kit that they know they can get through the next 1 or 2 days or 3 days for some folks, right? So I think that absolutely normalizing that fear and the aftercare that you're going to need, because it is a vaccine that may or may not impact your body in a different way. But creating that plan can really support individuals prepare ahead of time to know what can potentially happen, and maybe in that way, so lessening that fear that comes with getting something new, an injection, a vaccine in your body. So thank you so much. Thank you both for your time. There's one last question. Is there anything that I haven't asked that you would that you think is important to share, or that you would like to share with the neurodivergent community?
You asked amazing questions. I guess the only thing from my end is just that, I mean, every single person is experiencing this. Every single person, we are all experiencing this together, and everyone is going to have a different experience with it. And that includes when we're talking about having neurodivergence, like there's going to be, just because we are all individuals, there's going to be different experiences with this. But this is a really important time to make sure that all health is managed during this time. So that means anything that was a concern prior to the pandemic, to make sure that that is taken care of during this time also. But also making sure, like, any decisions on the vaccine are fact-based and informed, and really making sure you're coming at the decision from a place of truly thinking of the consequences of not getting the vaccine also. Because a lot of times the fear can be of what's going to happen in that immediate time of the vaccine, but there's the reason the vaccine's even a discussion piece is because of the reality of what can happen long term and what can happen even in months out without the vaccine. So really that being a part of decision making too. What do I want my life to look like in 5 years, 1 year, 1 month?
Yeah, I would say to the neurodivergent community is claim your heroes. Quite frankly, uh, uh, I would not have the life that I have right now if it were not for Alan Turing, who was the person who created actually this human mechanized computational machine that broke the Enigma code, which allowed, quite frankly, the Allied forces to defeat the Nazis in World War II. And not only was he a gay man and horribly mistreated for that part by his own country later, but he was neurodivergent, probably represented on the spectrum. And the reality is he saved millions and millions of lives and saved at least a partially just way of trying to live in the world. I won't say completely just way. We're not there yet, but he definitely was. So claim your heroes, and know that when you choose to be vaccinated, you put yourself into a position of perhaps being the next Turing.
Thank you so much, both of you, for your time. We really appreciate you taking the time out of your days to speak with us a little bit more about COVID-19 vaccine hesitancy, the amazing work that Hood Medicine is doing, and just how we could all better support the neurodivergent communities, have access to the COVID vaccine and beyond. So thank you so much. Thank you both for your time.
You're welcome.
Much. Thank you.